When a family first learns about a traumatic brain injury, the first thing they're doing is really praying for recovery. And it's not until, no matter what the medical professionals have told them, it's not until a discharge planner comes into the room and says, it's time for your loved one to go home, that the reality sets in that they are not going to fully recover before they go home. There are all kinds of challenges that they face that no one can be prepared for. So the Alabama Head Injury Foundation works with families early on to try to ease that transition. Some of the things that families are not aware of that they might need would be modifications to their home, expanding a door entryway, a wheelchair ramp, having handrails put in a bathroom. Also, the process of just applying for disability benefits.
I was blessed to be a freshman at the University of Alabama about 35 years ago, and I had a car accident on a rainy night after I had been working.
Carol was an engineering student with a full scholarship. Whenever she had an accident, she went to the hospital and was treated for about 30 days for a serious head injury, and that's the reason she became associated with the Head Injury Foundation of Alabama.
You go from being in the hospital to not having time with your friends, and then you go to the foundation and everybody is glad to see you, and they understand your accident and how it affected you, where other people may not understand, the public may not understand, because it's hard to see a brain injury. It was inspiring to see the president of the chapter, Tuscaloosa chapter. He had a part-time job, and that gave me hope that I could get a job one day, and so that gave me motivation to work as well as I could to get back to normal as much as possible.
The partnership between the United Way of West Alabama and the Alabama Head Injury Foundation is so key for us, because like so many of the other wonderful agencies that they support, the work that we do is not something that's easily recognizable by someone unless they have a family member or they themselves are living with the brain injury. It's an unknown piece that you're really happy to know when it's there, but otherwise you would never have any idea that those services were needed or available.
I just want to encourage people to do what they can to help. If it's praying, if it's volunteering, if it's giving, it's all going to be a blessing to them.